thanks everyone for being here for this panel discussion. One thing which we can outrightly promise you that it's going to be interesting because it is not based on anything which we read or find across Google or we could find. It is based on first-hand information of a team which went out and researched across hospitals. And what we'll begin with, in order to set the context, I really want to show a brief slides on what was the methodology and some of the stark findings which were there. And then the idea is to really set the context for the current discussion. And we have an eminent panel of speakers today who will be touching upon the topic. So without further ado, let me share my screen and show you a few slides which I think you'll really find interesting. So just a quick help, if anybody could confirm, you can see my screen, maybe Soumya.
Yes, we can see it, Ritesh.
Sure. Thank you, everyone. So the project really was a brainchild of MIHM, where we wanted to look into the digital transformation scenario across hospitals. And the objectives were simple: assessing technology absorption capability in Indian hospitals. And the framework for analysis was three. One was sensing, seizing, and transformation. And sensing was really, do hospitals in the research framework actually appreciate what technology could mean for them? What does technology, how do they sense that there is a technology need? The seizing, as the name applies, is like, what are the frameworks they deploy to actually evaluate these technologies and fall one stop, or let's say, before transformation and the implementation. And the transformation really is, how do you contextualize those technologies in your own landscape, and how do you deliver results or deliver on objectives which you aspired for? And we asked specifically some of these questions, calling them out, that did you achieve finally what you aspired for? How did you sense what is needed across your hospitals? Do you have a framework, or is it based on discussions, or how does it really happen? And then, the mid framework, which is the seizing, how do you actually evaluate? What do you look for in those opportunities? What could they deliver and not deliver? And the sampling frame was across tier 1, tier 2 cities, largely mid-sized hospitals. The student team, and all of them are here, and let me begin by thanking them: Aditya, Arvind, Lekhna, and Siddharth. Without them, this project would really not have seen the light, is what I strongly feel. And there was a mentor team which supported them all across this, but it was really they who went out and did this. So I would again really like to thank them. Now, coming to certain findings, and in the interest of time, we won't talk about most of the findings, but let me share with you some of the top three, which would be of interest to you. Look at this slide now. There is a correlation between technology score and PAT. And we are purposely calling out PAT here because there was no direct correlation between technology and revenue. It might be a factor of the way hospitals looked at it, the way they have the way they have thought through across the technology. And the whole idea is technology. The takeaway from this slide is it may have an impact on operations, and hence we are talking about profitability. The other way to look at it, which we think is maybe the case in hospitals, is that most of hospitals are looking at technology in terms of building in certain efficiencies which improve margins. Now that was one. And if I go to the second, now this is again, we have seen a lot, heard a lot, and there is a thinking that new hospitals which start ground up will get more technologies in place, healthcare technologies, and they will be much more evolved. But then our research showed that hospitals which have been in operations for more than 15 years.
Ritesh,
I think
sorry to
bother. Moving. Could you?
The slides are not moving. Sorry to bother.
Yeah. Could you share the slides?
Okay, just one second. I think let me share my screen again. Just 1 minute.
If you go on slide mode, I think it will help.
No, I think I went on the window mode. I'll just go on the entire screen mode. Just 1 second. Yeah, I think this should move. So, is this moving now?
Yes, it is.
Sure. So I'll come to the findings and quickly just brief recap. There was a strong correlation between the technology score and PAT. And why we are calling out PAT here is really because there was no direct correlation between technology score and revenue. And this could essentially mean couple of things. One is technology has an impact on the overall EBITDA, which in turns means it has impact on the overall efficiencies. But it could really mean that hospitals are implementing technologies to drive efficiencies. And that is one thing which we sensed when we spoke to them about, what is your view on technology? What are you looking at from a technology implementation? And this is something which we thought was really interesting. The second slide, I think you can see my slide moving now, just to reconfirm so that I
Yes.
don't. Sure, thank you. The other was in terms of old versus new hospitals. Now if you look at the graph on the left, these are the findings where hospitals that have been in operation for more than 15 years have actually shown a higher tech score than younger hospitals. Now we would essentially think, hospitals which are starting ground up, they would have thought through those technologies and it will be easier for them to go ahead and implement. But that doesn't really seem to be the case. The question here really is, are mature hospitals more evolved in their processes to deliver on technology? And this could be one of the routes which we have. And and this is something which was really interesting, especially when we saw the results. The third, and I call it here, is perception, the reality. Because if you talk about everything else, the hospitals which we interviewed, they perceived that the impact on patient satisfaction by technology is really high. And when we say perceived, when we ask them that, what have you done to track it? I mean, what are the cues or what are the factors which you see where you have tracked and has patient satisfaction increased because of technology? The answer was not straightforward because most of them did not have an objective way of arriving at that score. And this was hence this what we think was actually the perception there. And again, if it has delivered on patient satisfaction, it is really encouraging, but we really don't know. Now, given all of these findings, and there were few more which were across the maturity of hospitals and the variability in the answers and everything. But essentially, summarizing all of that, let me talk about where are they actually, and are we there yet? So three metrics really: efficiency, effectiveness, and excellence. And where is the larger cohort of hospitals we spoke about in all of these three metrics? If we start with efficiency, which is really process reengineering and what we call initial tech enablement and improving margins, 88% of the cohort was in this bracket, where right from sensing to seizing and to transformation, everything. But largely most of the cohort was in this bracket of efficiency. The next layer was effectiveness, where technology actually becomes a overarching part of your strategy. You leverage it to drive better clinical outcomes and really improve patient experience. And by improve, I mean you actually track some of those metrics. The good part is there were some. The sad part is there were not too many. And this cohort had actually 12% of the hospitals which we researched. And finally, if we talk about excellence, where technology actually shapes the future of healthcare delivery, it plays a key role in driving policy decisions and really goes ahead and defines new benchmarks. Now, if all of this sounds, something which is very idealistic, we have seen in countries like US, for the example, where FDA is accepting AI and digital as a part of their overall process. They are actually in their paper on regulatory submissions. They speak about rolling digital submissions, which can enable the future, which can really get drugs out to market quickly, and where they actually look at digital technologies as medical devices. Now here is where we define the service, and the sad part is, are we there yet? I don't think we have arrived there yet in excellence. That is exactly what our research showed and defining the future. With this, I think the question really is, what will it take to get there? And with that in mind, without taking further time, I would like to invite Professor Sarang. He's the mastermind, as I say, of this entire, the brainchild of this entire research when it started. He is the executive director of MIHM, as you all know, and I would like him to share, his initial views as a keynote.
Thanks, Ritesh, for those kind words. And I must say that while mastermind team says, one day I thought that we should do some research on digital transformation in healthcare organizations. And everything after that was led by a very capable team. But I think Ritesh has already highlighted key findings from the survey. I will not go there. I want to maybe just have a couple of broad remarks before we hand it to the panel. I hope that the audience is as excited as I am about this panel discussion. I've had some glimpses, and I'm looking for sort of the main movie to get released. So I will not take too much time. I'm standing between you and the panelists, so let me make it quick. For those of who work in the healthcare sector, either directly or are close observers like me, I don't think a single day goes by without some breaking news, right? About some new digital technology, digitization, digitalization. The keywords just keep piling. And these news tend to swing between extremes, right? Some will portray a very rosy picture of how technology is creating a utopia of seamless, coordinated care. Whereas on the other hand, some others will portray a dystopian future where basically there's a heartless healthcare system full of robots without doctors and nurses. We're also hearing constantly about the great things that are happening in policies and regulation regarding technology in healthcare, right? Ever so often, we'll also hear about see that sector, see how financial services sector has completely transformed itself, and what are you guys doing in healthcare? You should follow their lead. With all this, I think it's fair to say that either the transformation is about technology, that technology is transformative, or that the policies are transformative. And we miss this picture of, but who is going to transform eventually? Who's going to be the engine of this transformation? And so we thought, given that we come from a management background, it is fair to put the focus on organizations who are going to be driving some of this transformation or are driving the transformation even as we speak. And so from that angle, what we felt is there are basically three legs to this tool. Technology is one. And then there are people and processes which go hand in hand with technology to enable great things. So now, given that our healthcare system is so heterogeneous, we have an entire spectrum of hospitals and organizations other than hospitals. It is quite likely that the approaches that these organizations are taking or not taking for this transformation are also extremely heterogeneous, right? The second part is, if any one of you have attempted any sort of transformation, even in their personal lives, you'll realize that it is very hard and that it is a journey. There are starts, there are stops, there are good days, there are bad days, there are detours, and then there are stretches of being overspeeding on a uncrowded highway. So this journey is sort of up and down. It's not a smooth journey. What I'm hoping from this distinguished panel is some insights into these aspects. How are organizations deciding to undertake the journey? How are they navigating this journey? And then how these approaches are different for different kinds of organizations. There is no single journey. So with that, I will stop. Thank you again for allowing me to speak for a couple of minutes on this forum, and I'll hand it over to Professor Vijay, who will moderate the panel. Thanks a lot.
So at this point, we'd like to welcome Professor Vijay. Professor Vijay is Assistant Professor Operations and Faculty MIHM, who would be moderating the deliberations today. And with him, we have a panel of esteemed speakers who will be there. And quickly introducing the panel, Mr. Jalan, founder, Medium Healthcare Consulting. Jayashree, our own alum from 2008, co-founder and partner, Enzia Ventures. Dr. Sujoy Kar, Chief Medical Information Officer and Vice President, Apollo Hospitals, and Dr. Avinash, our own AMPH alum again, Cluster CEO, Diagnostics, KIMS Healthcare Management. And with this, I'll hand it over to Professor Vijay to start the proceedings, which all of us have been waiting for.
Thank you, Ritesh and Sarang, for that warm introduction and setting the stage for this panel discussion. At the outset, I would like to thank all the participants today who have joined this panel discussion the Saturday evening. So thank you very much. I have a small request for all of you before we get started. I have a set of questions with me, which I intend to ask our expert panel today. At the same time, we would encourage you to have your questions. If you have any questions, please try to type them in the Q&A box. And I will pick up some of your relevant questions as the time permits towards the end of the panel discussion. With this, I welcome the panelists again, the distinguished experts from the healthcare transformation team. So talking about digital transformation, as Sarang rightly said, the context, it has been a highly used management term in the past few years, especially in the healthcare sector. The use and the scale up of digital solutions is likely to revolutionize how people worldwide achieve their standards of health and also access services to promote and protect their health and well-being. In this context, healthcare providers have already started adopting digital technologies to embark on their digital transformation journeys. And this could be for several reasons, either to overcome their business challenges or because of peer pressure or environmental factors, or purely to develop competitiveness. So it could be any reason, but it will be interesting for us to start this panel discussion with this question, which I would like to route to Mr. Jalan, asking, Mr. Jalan, you have been in the medical consulting space for a very long time. You have interacted with a lot of healthcare organizations, especially the healthcare providers. In your experience, what have you observed as the key drivers of digital transformation in the hospitals?
So thanks, Professor Vijay. I think it may sound a little pessimistic, but I think in the healthcare context, transformation at this stage is aspirational, but it comes across as too strong a word. I mean, it is aspirational, I think, as Ritesh also pointed out in one of the last slides, when he spoke about excellence. But one thing which is there and which is there all around us, for folks who are in healthcare, whether you talk about those who are providing healthcare or those who are receiving healthcare, different stakeholders for that matter, that if you look around us, whether you talk about banking, whether you talk about education, whether you talk about entertainment, these are some of the industries where the digital transformation is, as complete as it can get. So it sounds unbelievable. So to that extent, there is a certain amount of, let's say, pressure, if you want to use the word, or there is a certain amount of inspiration, which, let's say, folks in healthcare industry draw from or can draw from. Now, in my experience, let's say, having worked closely with a few hospitals, see, when you're talking about drivers, the one very strong lever or driving force I find is productivity. Okay. And productivity. And for example, I remember having worked with a large hospital group where even today, when you're talking about X-ray, something as simple as X-ray, the patient actually has to pick up the film, okay, and has to first wait for the film, pick it up, take it to the consulting orthopedic surgeon for him to review, etc., etc. The scenario is not very different, or was not very different, let's say, when you talk about lab results. Somebody has to write it down, and then it has to be captured in a report, etc., etc. And there it was very evident that if you digitize or something as basic as that, it sounds like getting from manual hard copy to, let's say, digital format kind of a thing. It was very obvious that even a simple step like that would improve productivity, would improve speed for that matter. I'm just saying, and the orthopedic surgeon need not wait for the patient to come with a image or the film for that matter. So it would improve productivity, it would improve speed, and it would obviously improve patient experience. So what I find that one area where hospitals tend to, let's say, look at digital transformation or digitalization for that matter is productivity. How does it help gain speed and in the process improve patient experience? So that's one very obvious bucket I have seen. The second one is more tangibly business related, in the sense that how does it improve, let's say, decision making for that matter. So when you're talking about marketing, for example, if you actually are able to capture different data elements, let's say when you're talking about your patient, for example, something as simple as, let's say, pin code or address for that matter, do you have a much better understanding of catchment area? Where are the patients coming from? Okay, does it help you do better targeting, better planning? Are you talking about age or gender, or are you looking at family as a unit for that matter? How do you enhance loyalty of the customer? Can you do some follow-up exercise, etc., etc.? So and similarly a lot of work obviously goes into, again, a very obvious area is materials management, because materials comprise a very large cost in any hospital setting. So if you're talking about consumables, if you're talking about, let's say, medicine or pharmaceutical products, etc., etc. So I'm just saying primarily two areas. One is driven by productivity, and which would in turn improve speed and hence patient experience. The other is more business related. How can better data and better data management analytics help in decision making? So I guess these two are the more important areas.
Thank you, Mr. Jalan. That's interesting that there are two sides of the interest, right? As Sarang mentioned in the beginning, it's not just about the technology. The driver could come even from the process side, the productivity side, which relates back to the people aspects, and also, of course, the business or the commercial reasons behind it. And especially when you spoke about it will enhance the decision making or the act as a decision support system, that's quite interesting. And this makes me to route this question to Jayashree, who is the co-founder of a venture fund, to take her views about the drivers, because I feel it is important to also look at some other organizations, other healthcare organizations, which are not big in the market, right? There could be small players, there could be medium-sized enterprises in the healthcare, which may not really have a strategy at the top of them to drive the business reason as a driver. So, Jayashree, in your experience, what are the drivers for digital transformation, especially in the healthcare sector?
Sure, Vijay. And just to set the context, my journey in healthcare digital transformation began when I was leading merger integration at the largest hospital chain in Asia, IHH, before starting NZia Ventures. And before that, we invested in a lot of hospitals, right? So if I look at the larger ecosystem, I think there are two categories of drivers. One is some of the external environmental factors, and second is just the business factors, right? And on environmental as well, I would say there are factors. One is technology. I think technology is at a stage today, the technology evolution, the technology infrastructure, all of those are at a stage today which are kind of pushing and enabling technology innovation in all sectors, right? And I think healthcare has a lot to catch up versus some other sectors like transport and food, but that's definitely one sub driver. And the second is patients, consumers demanding, right? I think more than earlier, today patients are demanding much more convenience and much more transparency. And they are demanding, like if a cab, which I used to sit in 5 years back, I didn't know the time or the cost or the distance, but today with technology, I can. then for an appointment, why don't I know the waiting time in advance? Like, why can't I? So I think there's a lot of patient demand which is happening, right? And I think the other related thing to one, the technology innovation is, I think there's a realization that either you get disrupted or you disrupt, right? So I think that looming threat is there. And you can see some of the global hospitals, and even in India, some of the leading hospitals have hence not only adopting tech, but they're also investing in technological startups, because they're clearly seeing that as the next driver of growth, right? So I think that is on the environmental factors, Vijay. On the business factors, having looked at hospitals as an investor earlier in Khazana, the return on capital in this capital intensive business has been poor, right? To say the least. Even to come to 20%, which is respectable in some sense, is not easy. One, it's because capital intensive. Two, it's one of the most operationally intensive industries, right? So I do think even when someone is just thinking financially and thinking, okay, how do I get a better ROIC? I think there are levers on having better asset turnover and better profitability, right? And I think while a lot of people have focused on efficiency, which drives profitability, what we've seen in our international benchmarking is hospitals who get the asset turns right, from 1x to 1.5x are really like the cream versus the belly. Okay? So I do think, and I think Ritesh touched upon, nobody's thinking about revenue transformation or revenue levers. I do think that is clearly a pressure hospitals are feeling for sure, but they've not yet been able to holistically put their minds and leverage technology to increase revenue. But I do think that is definitely a driver, because there is a lot of pressure. I think it's a journey to realize how technology can help, both by external examples as well as internal adoption. But yeah, I think those briefly cover the thoughts that I had.
That's great. Thank you, Jayashree. Thank you very much for bringing in the competitive and the external factor aspect to this. And that is quite interesting. And when we see the overall healthcare landscape globally, I mean, it's quite diversified, right? I mean, different countries have different ecosystems of healthcare, and not what worked in one geographical location, it need not work in another geographical location. So the diversity of healthcare by itself poses an important question to think towards the Indian context. So let me change the gears, more focused to India. And if I have to ask Mr. Jalan, what are the key trends in the digital transformation that you have observed emerging in the Indian context? And at the same time, what can we as Indian healthcare organizations learn from the countries outside?
See, I think one area where a lot more can happen when you're talking about digital transformation, and I would say is clinical outcome. And I'm just saying, I think unfortunately in the Indian context, I'm just saying a hospital just has to say that we are the best and we are the center of excellence and we are world class. Okay, there's no substantiation required. So I think it's a slightly unfortunate reality that when you're talking about clinical outcome, by and large, barring certain exceptions, we don't respect data. We don't have data. We don't respect it. You do have a few exceptions. You're talking about hospitals which actually do fair amount of research and research publications. And obviously, if you have that focus, then data becomes very integral to the way you do things. So I'm just saying, whatever little I've seen and I've observed, even the likes of, let's say, Arvind I or L.V. Prasad for that matter, I'm just saying you find them capturing clinical outcome very systematically. You find complications and to that extent, they have the ability to trace complications, and obviously for the same patient profile for that matter, back to a surgeon or back to team which is performing a certain kind of surgery, etc., etc. And to that extent, analyze that, I'm saying what is it which could have gone wrong systemically. I'm just saying, does it have to do with a particular physician, or is it a process issue or a protocol issue, etc., etc. And to that extent, how can it be fixed, and how can they do better than what they have been doing. So I think one area where, and you do find some positive indicators, but they're more at this stage more on an exceptional basis. I don't have a great amount of first-hand experience, but I believe I've heard some good things happening with Fortis and obviously Apollo as well. But this is one area where I think, like I said, there are some early signs that some work is happening, but I think a lot more can happen here.
That's great. I'm glad to hear that there is evidence that some work has already started in the Indian context, and some hospitals which you have mentioned have been trying to progress in these journeys. That is an interesting aspect. Now, let me bounce this question back to Jayashree. Jayashree, in your opinion, see, one is technology. I mean, having a technology, trying to automate things, trying to enhance efficiency is, of course, it is inherent part of the transformation, right? Now, there is something which could work, which could show some indications of this is what will work in our context. This is something which worked in, say, in the US hospitals or in the Middle East, but this will not work in India. There could be some things which would help us to feel what is emerging in the Indian context. And what are your views on that?
Yeah. So before I come to some examples from what's worked, let's say, even closer to India, let's say in Singapore, and could definitely work in India, let me just add a point to what Mr. Ratan Jalan said, which was a very interesting point around data. So in fact, in the previous organization, some of the initiatives I led, which was a lot around data analysis, we could deliver 30% increase in bottom line, right? So it was terrific, but the problem was the technology tools we were using were not talking to each other, right? So while what's happening in India, while the departments are thinking, mujhe ye technology chahiye, mujhe ye chahiye, only the larger organizations which have a strong CIO are thinking holistically, and hence departments talking to each other, and hence having data in a structured manner, which you can leverage, and that's a gold mine to have P&L efficiencies, right? So I do think that was a very interesting point Mr. Ratan Jalan touched on. On the other thing, Vijay, just firsthand, a pain point that I observed, and I was in the hospitals during this 2016-2018 era, when a lot of pricing caps were levied. So one example I do want to draw is how our hospitals, Mount Elizabeth, Gleneagles in Singapore and Hong Kong adopted a technology for better pricing effectiveness, which from the grounds up, I was kind of trying to understand the best practices globally and push for our hospitals in India as well. But let me first lay out the context in India better before I go to the Singapore example, right? So in India, if you talk to the common man, today, the biggest pain point they have with the Indian private hospitals is the deficit of trust. And the deficit of trust, the root cause is pricing transparency, right? And while a lot of large hospitals have realized, and if you see in their processes itself, they will have a financial counseling, which is done, and there's a conscious effort to improve it. It's all manually. We are not leveraging the power of technology today to do a better financial counseling, to do a better pricing prediction, right? Which is happening in your Ubers and Olas today, but you've not leveraged technology. And exactly because the data is not structured. So the root cause is data somewhere. And hence I was saying that was an interesting point Mr. Ratan Jalan touched on. So in India, for example, when the pricing caps were coming in on the stent and on the knee implants, all hospitals struggled initially. But later, if you see, all the package prices have caught up with the same package prices as earlier. Because what the industry is doing today is, while they were getting a fat price on the stent and implants, they were cross-subsidizing their nurses and beds, right? But the patient wasn't seeing that. the patient was saying, oh, the stent cost price is this versus the MRP is this, ye hospitals loot rahe hain, right? And hence the lack of. So I think what hospitals needed to do was more package pricing and more package pricings than just the simplest one, right? Versus separating the stents and implants. So what these hospitals in Mount Elizabeth, in Singapore and Hong Kong, they've done is they have implemented an artificial intelligence engine. And now through that, they are predicting pricing and communicating to the patients what is going to be the pricing, what is going to be the average length of stay. And the accuracy of that engine a few months back was about 80% and increasing as you fed more data, right? So I do think that will definitely kind of build patient confidence, patient trust, which is the most important success factor for a healthcare organization. But more importantly, I also think it will also help hospitals realize a lot of lost revenues by pricing themselves better, by doing better scientific pricing as well, right? So I do think that's one example. And to Ritesh's point earlier, I mean, it leads to direct revenue increase also in some cases to hospitals. So yeah, I do think some of those can be transformative as well.
Sure. Thank you, Jayashree. And I appreciate your shift from starting from the data, the importance of data, and then moving on to leverage data to kind of make meaningful information out of it, which will help us to create probably a decision support system, which could help us to bring more pricing transparency and so on. At the same time, I also feel that this is an important point which to touch from bottom line impact, using technology to create efficiency. I think now you are shifting the gears, as Ritesh mentioned, the 3 maturity levels from efficiency to effectiveness, right? Now we're talking about transparency, creating an ecosystem which is more effective and patient friendly. Thank you, Jayashree. Thank you for bringing these points. I also noticed you spoke about the role of chief information officers when you were trying to give some examples, and we have our chief medical information officer of Apollo with us today. So let me take this opportunity to ask him, Sujoy. So let me route my next question to you, very specific to your experience in transforming some of the key processes or embarking the journey in Apollo. What are the key candidates that you prioritized in your hospital for digitization? And what was the rationale behind it? How do you generally prioritize that these should be good candidates to digitize in a hospital?
Thank you very much. First of all, really glad to be on this Saturday evening talking over this panel and sharing some of these thoughts that we have at Apollo. I think we heard about excellence, we talked about productivity, we talked about pricing, we talked about a lot of things around what we can actually get through digital transformation. But it is also important to actually begin with a digital strategy for an organization. And what encompasses a digital strategy? And you can actually look at it in digital strategy, which is the capabilities of powerful IT solutions, readily accessible technologies, and then the changing market landscape, which Jayashree was talking about. If you take all of these together, there are 3 or 4 very important elements for that. First of all is, how do you look at the customer engagement or customer centricity into this? So what the entire digital transformation does, look at both the internal customer and the external customer from an Apollo perspective to see how do we fulfill their needs? How do we enhance their workflow? How do we improve their experience on that? And then second one is, of course, to get the state-of-the-art digitized solutions. Lots of EMRs companies, there are lots of PACS companies and lots of other things that are there in the market. How do you go about in choosing how does that fit your needs? How do you go about in, putting it in that perspective? And third, whatever you do in terms of digital transformation or digital disruption, if I may use the word, what is your operational backbone to fulfill the needs of those? How do you look at your operational backbone to actually see that your digital solutions are fit, or your digital strategy fits into these kind of things? And then there are three more, which I would like to also highlight in terms of, what is your capability for agile systems that could integrate into your systems and deliver the care. And then finally, what the example which Charan sir was giving, that he does see that, there are a lot of patients moving with X-rays and moving to orthopedics doctors, even in that. What is your adoption for those clinical solutions that you actually, IT solutions or digital solutions that you actually give it to your consultants? How do they adopt and how do they see? And this is not just unique to orthopedicians. I've seen this in Intermountain Healthcare, which is possibly one of the world's best digitized or IT solutions for healthcare, where people also go with MRI scans and CT scans to show the doctor because the doctor prefers it that way. So just to say that is not available in his window at the moment is possibly not correct, but also that, it is available. It is something which is they can go about and choose which way they want to do that. But I want to come into fundamental things which you need to actually change in doing this whole thing. Mm-hmm. Look at how you design. Look at how you design your solutions in an appropriate way. Look at how you change the culture of organization by which you adopt technology at every level so that you can deliver it to all the customers that I've just spoken about, and what the role that the leadership plays in all of these to actually take it through over the organization. I can go into the depth of each one of them, but this would be my introductory remarks to actually see, first of all, to actually look at customer engagement, digitized solution, and operational backbone, which goes together to give your and think about.
Great. Thank you, Sujo. I think you brought in an important ecosystem view, right? I mean, one is the technology strategy, which should drive the entire movement. I have, in my interaction with some of the healthcare organizations, I found the excellence happening in pockets. And I think that was one reason why many organizations may not be able to sustain it for a longer time. Now, this is an interesting point. I think Dr. Sujoy has mentioned about how to start with the technology strategy, which touches about various aspects of an healthcare ecosystem, starting with your customer, to your operational capabilities, your agility, your change management, and then building a culture of change. And I think this ecosystemic view is quite interesting. And this also puts me to ask you another question. I would route this question to Dr. Avinash. Avinash, from your experience, now when we are looking at this ecosystem, there are several aspects to it, right? One could be the clinical processes, non-clinical, it could be managerial outcomes, or it could be patient outcomes. Now, many organizations, especially hospitals, when they go for digital, there is a huge amount of investments which go into this. And it's not guaranteed that every hospital which goes for a digital transformation eventually succeeds. And this failure could lead to a huge loss of investments. Now, in this context, and adding to Dr. Sujoy's point on the ecosystemic view, what do you think, or when we think of a digital transformation, where should the investments go in a hospital?
Thanks, Professor Vijay. I think there are two aspects to it. The biggest pushback when it comes to digital transformation comes from doctors. The more senior the doctor, the more pushback is more likely. The best people to catch hold of digital transformation is the young generation resident doctors and the new nurse force that comes into the hospital. They are all digital literate. I would say they are more savvy on the technology part. The second thing is, moment like Sujoy said, when you create a strategy for IT governance, it usually starts top down. I think the culture has to come from down up. So take the ground level people into the game first. When you think big, you think of EMR, EHR, things go messy, things go hoary. And the pessimism of adoption of EMR gets even worse. So I'm saying, look at the most optimistic opportunity. The lowest hanging fruit when you're talking about invest is invest in people, not in technology first. I'll speak from experience. When we decided this journey of digital transformation in Ruby Hall Clinic, Pune, we decided to choose a process automation. We just took a simple thing of barcoding and QR coding pharmacy. When we started barcoding and QR coding in pharmacy, we started with a simple thing on expiry. Then we started looking at medication error reduction, dispensing error, prescription errors, bi-directional integration. It was a win-win for the nurses. It reduced their headaches. Doctors were more happy. Pharmacy had less inventory headaches. So this was a very low investment opportunity to have a one small win in the digital transformation journey. The second thing happened was when we decided to go for an EMR. And then we decided in EMR what would be the challenge and in the investment. And then we decided that legacy, our HIS was our biggest hindrance. Second thing, our biomedical integration and device integration was again a part where there was a lot of ignorance. The third thing was the, the workforce was not ready. So I think every organization needs to look at these challenges and then decide what's the best way forward.
Mm-hmm. That's interesting. I mean, you brought in the people aspects, and I love the way you put it, like more tenured doctors sometimes are resistant to change, and the change management process becomes quite complex with some of them. I agree with you. But what is your opinion about players outside the hospitals? I know hospitals would be partnering with other healthcare players like diagnostic labs, or it could be equipment providers, TPA, or even pharma for that matter. So Avinash, in your opinion, what role all the other players outside the hospitals, whom hospitals partner with, have a role in the digital transformation?
Yeah. So there was a question from the audience also, which I've answered offline. So digital transformation, we need to look at in three different parts. I would break it up into digitization. So digitization of records, basically for external agencies who are already pushing us. And why do we do digital digitization of records? Because it helps us in faster reconciliation. Our AR becomes easy. Talk about CGHS, ECHS, TPAs, they all are interested in the first journey. So the journey has started long back. Maybe we don't consider that as a part of a digital journey. So every organization who feels they are not in that jumping into that train, they are already there. Second thing is digitization of a process or digitalization of a process. Like I said, the pharmacy is one. Second thing is your lab integration is one. If you have a laboratory information system, only your laboratory reports are getting digitized and maybe moving on to HIS. It is not the solution. You need to have a bi-directional integration where HIS lab and HIS talk to each other. And then you have an external opportunity where the reports are pushed to patients and to doctors. So that is a completion of a lab integration and digital process. Similar thing to radiology, blood bank. And these are all early wins, which basically are driven by external influences. So like I said, CGHS, ECHS, government bodies, yes. NABH also, when he talks about safety, quality, patient, what we call compliance, then these are the processes which also make us look internally and see the opportunities. And the last option is, of course, when you're talking about partnering with health tech startups, med tech companies, EMR companies, EHR companies, digital health companies. Here we are bringing something called as edge computing very close to the customer. A lot of data will come in. COVID pandemic gave like mushrooming of digital health companies. A lot of data, meaningful, meaningless, whatever it is. But what are we going to do with that data now? I mean, is there anybody helping us to understand that big data opportunity? So I think all of these touch points, my only word of caution is, let's not start the digital journey towards a customer touch point first. Let's look at internal, improve a process, win from that, create that team. That team is your culture. It's not your 60-year-old legacy or a managerial legacy which drives the transformation. It's the small wins which will drive the change.
Oh, that's amazing. And you mentioned about transforming data into some meaning, what we get out of it. And while I was reading one of the articles regarding the recent COVID-19 data, which was abundantly available today, I found that there was a fundamental question a few articles were addressing about, hey, who made the biggest use of this data? Is it the healthcare providers? Is it the equipment manufacturers, or is it TPA? The interesting answer I found was it was startups. I mean, many of the startups in the past 1 year, I think, or a little more than a year, the number of healthcare startups have increased significantly. And I think adding to Avinash's point, it will be interesting for us to know how startups have leveraged the data which is abundantly available across the ecosystem, and then look at their role in the digital transformation. So I will route this question especially on startups to view what Jayashree has to say about it.
Yeah, I'll come to startups, but just on what Avinash said, I think just with my brief stint in hospitals, can't agree more. It's so much about internal process streamlining before you kind of overlay the technology layer, because till you standardize your processes and your team is motivated, how much ever technology you try to get, you will never adopt, and hence you'll never win. So completely agree with that. On some of the examples, Vijay, who've leveraged data very well, I'll give one example from our home country, from India itself, a startup where I saw the AI engine and how they beautifully leverage technology to build in efficiencies. And a similar thing is being adopted by a startup in Singapore as well. So the one in India, DocSat, I've been tracking the journey closely for the past 3 years. And when I saw their AI engine itself, right? So what they did, it's a telemedicine platform. What they did was initially the doctor used to interact with the patient directly on a chat, right? But later they could leverage that data to have a chatbot asking smart, intelligent questions to the patient. Using AI, they could synthesize that information to say, hey, doctor, this is all the information I collected on the patient. This is what I think the diagnosis and the recommendation is. Do you agree, disagree, right? And then the doctor used to kind of act on that engine. So now what happened was two things, Vijay. The machine was learning more and more. You were still relying on the doctor to give the final prescription. So you were still following right protocols. The doctor was able to see many more patients within the same, while earlier the doctor was taking 3 minutes, now the doctor is taking half a minute to kind of review. So truly, I think what I saw was leveraging data to build the AI engine. At the same time, you're not letting AI rule, because we all know AI has its own shortcomings. It's a topic in itself because of biased data being fed and all. So I think it's this journey, but beautifully leveraged in terms of delivering better efficiency. And similarly, the another app in Singapore, Doctor Anywhere. So I was speaking to my colleagues in IHH before this panel to say, hey, give me one example which has really transformed or helped hospitals even during COVID. So apparently Doctor Anywhere again is a telemedicine platform, which is quite present in 10 countries, Singapore, Vietnam, Indonesia, Malaysia. They've raised cumulative 100 million now. But I think the beautiful thing they have done versus what I'm seeing in India is they've truly been able to integrate phygital. So not just online, but they've been able to implement themselves in about 2,000 physical setups, right? So now what they're doing is, while the patient is going, your data records is all in one place. And especially all these countries in Singapore where the aging population is increasing, they were anyways identifying this tailwind even before COVID, to say the senior citizens are not able to travel and come. Can we leverage some of this, right? I think COVID was a strong tailwind, but so they are also leveraging technology to build in and data to build in those efficiencies. But yeah, I guess these are two related examples in different geographies leveraging data. And I think a lot more can be done. But I think, like a lot of panelists touched upon it's about, in India, I think it's a lot about just first creating the spine, the data between different departments talking to each other, data integration, data structuring. So a lot more to be done. I think this is a beginning.
I agree with you, Jayashree. And in fact, I think the COVID-19 has given a great push to what was happening all around the world in bits and pieces about the telehealth, especially leveraging the technologies towards the patient care. I mean, the value that driven through the patient care for technology has increased significantly on that. Now, Towards the last part of the discussion, I have a few questions related to some guidance to our listeners about if a hospital would like to embark a digital transformation journey. I would like to hear from the panelists about how should we go about it. I mean, it's a simple question, but I would like to structure it that how to prepare a hospital for digitization. I mean, some of you spoke about processes, some of you spoke about data, some of you spoke about people, especially on culture building, on leadership and infrastructure, and so on. Now, if I have to kind of ask this question to Mr. Jalan, how would you prepare a hospital for digitization?
Professor Vijay, I think the most essential component has to be the culture and the leadership piece. And then something, let's say, Dr. Sujoy spoke about, that when you're talking about digital transformation, it has to be looked at a big picture strategy level. I mean, if you don't have that, then my fear is it's going to be very superficial, like, we also do this, or very cosmetic, or even very tactical. And I think if you get onto that path, then you've lost it all. I mean, that's my fear. So let's say even when Dr. Avinash spoke about Ruby Hall, I think what was, to me at least, evident in that case was that even being tactical was a part of the strategy. So there is a big picture goal. There is a vision that, I mean, this is all that we need to do. But given the challenge which is inherent in adoption, and I think he was brutally frank when he said senior physicians, I mean, are the biggest bottlenecks, in a manner of speaking. But I think if that being the challenge, you can't take a idealistic view. You actually have to start from people, start from the bottom, he said. So I'm just saying there's nothing wrong in being tactical if you have a strategic vision, if you have a roadmap, if you have an intent. That's one. The second, I think, is that a large number of time, even if you have the intent, things fail because you have not understood the pain points, if I'm use the word, of different stakeholders. What motivates them and what are the barriers. Dr. Sujay spoke about Intermountain Hospital. You have a group of physicians who, even with the best technology, are comfortable doing things in a certain way. So obviously somebody has not taken time to understand that what makes things happen or what prevents them from happening. I mean, early this year, I had a GI episode, and I was in a hospital for about a week, and I'm talking about one of the best hospitals in the city, for that matter. Now, when you are a patient, I'm just saying, you obviously are not in the best shape. I'm physically, mentally, every which way. Now, do you realize, Vijay, as a patient, you need to, within quotes, control the bed. I mean, you may like to control the air conditioning. You want to call the nurse call system. I mean, you want to, television or whatever. I mean, can you imagine what does it take to access, if I'm use the word, these 4 or 5 different devices, and what does it take to control? Now, I'm just saying whether the solution, you and I may like to call it digital or like to call it something else, but these are the points which actually, I guess, are frustrating, and to that extent they also create some of those let's say, I mean, even if you want to call it big opportunities for transformation. So I think one is the leadership and looking at this as more as a strategic opportunity, and the second is a very deep, nuanced understanding of different stakeholders. Either the beneficiaries, okay, or let's say people who are expected to adopt it. I mean, those two, I guess, would be the big pieces.
Thank you, Ratan, for that. Now it will be interesting for us to hear an example. Actually, maybe I'll route this question to Sujoy. Sujoy, can you please share one example of successful digital transformation? And this also puts me to understand, how do you define success, firstly, And then if you can give us an example of a successful digital transformation in your experience.
Right, great question. How do you define successful digital transformation? First look at it in terms of clinical excellence or clinical success that you would get. You would look at patient objectives, how you look at the patients, how their outcomes are looked at. And one of these things that we currently are working with Karolinska Institute on patient-related outcome measurement, where you are having a digital platform to actually report the outcome from the patient's files and creating your own clinical excellence in terms of how do you see length of stays and or how do you say infection events and stuff like that. So that is one. And of course, you look at your financial figures as well from an operational perspective. You look at how you define in the success. But I think if you have to ask me one specific metrics at the beginning of the whole journey, it is about how your clinicians adopt to those technologies and how they're going to use them in that perspective. Now, I heard what Jayeshi was talking about in terms of COVID and all. If you go into MIT Technology Review of May 2021, they came up with a very interesting article. They said, no AI ML algorithm made in COVID could actually make a deep impact. And it comes from MIT Technology Review, which they have looked at all the different kinds of solutions that are there, from predictions to drug repurposing to drug discovery to whatever AI ML that you could actually do it in that, including one of the work that I published in Nature, and it's available in public domain. So I see that about using an AI tool to actually predict outcome on 7 days and 28 days. I have one very important message in terms of how do we go about in doing digital transformation in organization. We have looked at standardization model in terms of how we go through the accreditation process, where we go from a low standardization to high standardization perspective, right? We now have to use the y-axis, where we move from low integration perspective to high integration perspective. And if you make 4 boxes out of that, you would see that there are diversified organizations who are low on integration and low on standardization. And I don't want to mean there that they are not good institutions. Best of the government organizations could actually fall on those categories if you put on low standardization and low integration. But probably they will be doing much better if they take the journey and become high integration and high standardization and move from a diversification business model, something which is we call as unification business model. Doing this, top 5 or 6 things we talk about, shift from a dispersed way to a global model, take in technology, new technology, upgrade legacy system into one integrated system, connected devices, look at security, risk, privacy, and hire people. For all of those who are CEOs here, probably you have the potential to know who is the right people. Possibly we have the chance to build the right people to actually lead those journeys. Thank you.
Great. Thank you, Sujoy, it was quite enlightening to listen to the way you defined success and kind of backing it up with an example as well. I would also like to hear the success definition from Avinash. Avinash, how do you define success for a digital transformation?
So before I come to answer that question, I want to make a comment on what Mr. Jalan said. I don't believe leadership and culture I don't consider them in my experience. I would go beyond that. I think you need to look at your hiring practice. You need to look at your HR practice. Are we ready for digital transformation? Are we creating a workforce opportunity We need to change that concept of hiring only doctors and nurses. You have to understand there is a big opportunity for STEM bioinformatician who's going to come into this game. That's the way to go. So change the behavior of your hiring. Second thing, coming on the success part, there are two important ingredients of success. Success alone is not mine. It is my digital partner also. One of the big success we had in Ruby Hall with an example, we did a partnership with Honeywell Healthcare on automation, wayfinding, geofencing, and tracking patient as well as assets. It kind of gave us a very good opportunity to see the nurses were not losing the idea about where the patient was, whether he's gone for a lab or he's gone for a test. The relatives were not searching for patients. There was a real-time dashboard evaluation, whether the patient has left from radiology, has gone to echo, has gone to the corridor, has left the building, come to the lift. Relatives are less anxiety. This brings about patient experience. It also monitors deviation, talks about manpower planning, talks about workflow improvement. So these are small wins of success which we could measure. And this was done as a pilot. Why? Because Honeywell automation was also in a very, very nascent stage of coming into healthcare. We chose the right partner at the right time. So that was a win. Coming again to the second part of success was when we decided that the best way to move forward was talking about how can we help laundry management. That also is a part of a digital journey where the nurses are spending almost 20 minutes every day counting laundry and linen. They should be taking care of patients. Now, if you look at this kind of internal journeys, you will find a lot of opportunities. And then the nurses are saying, hello, this is a great thing. And now I'm ready to partner for a larger EMR opportunity or maybe any other journey. I measure success when internally you are rewarded, not by somebody outside getting an award. Sorry, doesn't help.
Quite interesting. I think both schools of thought are like two sides of the coin, right? I think, as Mr. Jalan mentioned, how a leadership plays a role, and then how Mr. Avinash kind of brought in the school of thinking, like how my internal systems are looked holistically, not just about clinical. We have to look at the bigger picture, like even small thing, not small thing anymore. I mean, the laundry services also play a role, and looking beyond the organization. I mean, looking at the other players in the value chain, like a full value chain of healthcare. Because once a digital transformation happens in a hospital, it's not just the hospital. It's the suppliers, it's the patients, it's the beneficiaries, everybody, the partners, everybody get benefited. And even for the hospital to be successful, everybody has to kind of collaborate in one way. I think both the schools of thoughts resonate very well. And I feel the listeners would have derived a lot of useful points from our discussion so far. Now, I would like to stop here and kind of look at some of the questions from the listeners. I found an interesting question which I would like to route to Sujoy first, and then I will hear some of the views from other panelists as well. The question is, do you feel digital transformation in healthcare will bring some transparency? I mean, this question, if I have to complement it with some of my thoughts, I would say for patients, what we do within the hospital is not always visible, isn't it? We may do many process transformations within the hospital, some clinical, non-clinical, but what is seen is what is felt. Now, patients may not be able to witness the entire big picture of what is happening within a hospital. In this context, if I have to ask you the question of transparency, which we can bring, I'm not talking about the pricing transparency or transparency in any of the outcomes, but I'm talking about the transparency of digital initiatives being visible to the customers or patients rather.
Fantastic question. You know, this is an everyday job for anyone who work on digital health to actually see how they build on systems which can actually be transparent. Or for that matter, I use the word when I build my clinical AI ML models, how they're explainable. Because if you are not building something in digital health which is explainable to your doctors, possibly they will not be able to explain this to the patient. Remember when I started and talked about the digital strategy, I talked about customer engagement and customer centricity. Now, if you break down customer engagement and customer centricity, the elements that we get to see here is first, it begins with trust and transparency. It begins with inclusiveness. It begins with fairness. And how do you create that transparency by doing certain things where you say, how do you collect their data? Where do you store their data? What do you do with their data? How frequently they can access the data, and how easily they can access the data. So that is the perspective on where they are looking at their data. And understand this, that when you make your systems, your transformation systems or your EMR systems, or whichever way you look at it, you have to ensure that the data is not only available easily, but their data is available with its completeness. That is very, very important. Many of us, we give only the discharge summaries and lab reports and the diagnostic reports, and we leave it at that. If the patient seeks more, you have to give it. A very simple example is like, when you look at pathology slides and blocks, and how do you go about and giving them that when they actually require them in the process. Secondly, from the explainability perspective, what is that you do to build trust in your system? Particularly relevant when you are actually using AI in clinical perspective, right? And if you do not bring in that conversation at the very beginning, if you do not put it in terms of the consents that you build now, particularly for data capture, which by legally you will have to do if you have the similar standards of the GDPR and HIPAA come to India through the Data Protection Bill 2018, you would have to do at some point of time. How do you respond to that? So never pass out of the whole thing that you can build wonderful systems about digital transformation or enhance your digital strategy without being transparent to your customer. Great question.
Great. Thank you, Sujo. I think this point was kind of spoken by other panelists as well. Jayashree spoke about transparency. Sujoy emphasized about the transparency and customer intimacy for that matter in the transformation. And I feel everything starts with the customer, irrespective of what business we are, right? Whether it is healthcare or anything else. And in healthcare, I think it is even more important, given that one, it is pure service where patient can feel immediately what we are doing then and there. And also it is a socially responsive sector where the bigger role
Vijay,
of
if I may just use one idiom here, nothing about me without me.
Wow. Interesting. Thanks, Sujoy. So thank you very much.
There's one point, Vijay, one quick point. And there's been a lot of talk about transparency and how could digital transformation address the lack of it. I think somewhere what we also need to introspect, to what extent lack of transparency is intentional. So I'm just saying, if you're talking about a hospital where in 90% plus cases, the actual bill is more than the estimate given to the patient, then can the digital transformation really address it? If it doesn't help a hospital to actually tell a patient that if you come here, you got to wait for 2 hours to meet a patient, then no Ola or Uber is going to help. I'm just saying, it's not a question whether you have the technology, we can help you communicate that. You just think that no, you actually don't want to communicate. So I think let's not trivialize that part of it. I mean, the digital transformation cannot fix the intent.
Interesting. Avinash, any thoughts from you?
I think we need to look at a very simple fact. When you're talking about digital transformation, it is not going to overnight bring in transparency. It will just bring a process improvement change, and that itself will take out the opportunities of making it very clear that how can we deliver a better service. But please start the journey of digital transformation from a very internal. Don't be customer centric for the first year at least. Be internal to the whole thing. If you think that just because of a mobile app telling you are going to wait for 2 minutes and Dr. Jalan is going to be there to see you in 5 minutes, that's not the goal. That should not be the goal. That's a pure marketing exercise. I feel so. I feel look back inside whether it can save you enough money at the back end by improving processes, that goes in your investment. There are a lot of questions on the side on investments, or how many people should be working in the digital transformation team, how many people. It's not about getting new people. The same people will work. My only thing is, let's look at it from a very broad perspective, a very holistic perspective.
Thank you, Avinash. I think again there are both schools of thought appear very valuable to us, and I would wait for research to show some causality on both these claims. I know the experts here a very rich experience when they say this, but both schools of thought appear to me like very interesting. Both have the stakeholders element to it, one internal stakeholders, one external stakeholders. It will be interesting for the research to answer such questions. We'll leave it to the researchers to do that. And being part of the academia, I would allow to leave it there, right? And another interesting question which I found here in the Q&A window is, what is your opinion on the possible impact of the upcoming National Digital Health Mission in accelerating healthcare transformation? And I think this is the question which is highly debated in the past few months over the internet. And it will be interesting to hear the panel experts' view on this. Let me start with Mr. Jalan on this. What is your opinion on the possible impact of the upcoming National Digital Health Mission in accelerating the healthcare transformation?
So I think the scale at which it is getting attempted, okay, it would certainly enforce, if I may say, and the government being a huge influencer, as a regulator, if you talk about Ayushman Bharat and stuff that kind. So I think it will certainly happen. I think somewhere the reservations are about privacy of data. The reservations are about could this be let's say misused, if I'm use the word, to paint a certain picture which may suit let's say the political messaging and stuff of that kind. So I think there are certain reservations, but given the enormity of the scale, would that necessarily drive adoption even for the smaller hospital for that matter? I guess it will.
Okay. Jayashree, would you like to also address this question? Your views, please.
Yeah, it is definitely a step in the right direction, but can't not agree more with what Avinash was also saying. When you actually start to implement, it is so much about people, capabilities, processes, standardization, integration. So I think it's a journey, but it's definitely a nudge for all stakeholders to start thinking, because hey, this is happening and you better start preparing, right? So I think it's a step in the right direction, and a lot more pieces to be. When I speak to a few startups, they are not so satisfied with the pace and some APIs. So I think there's a lot to be streamlined on the ground for sure, but definitely a step in the right direction, and looking forward to the journey and play a role in accelerating the same.
Great. Thank you very much. I know some of the questions which have come up in the Q&A, our panelists were kind enough to type in the responses there to address specific questions. So thank you very much, panelists, for doing that. So I'm not going to pick any more questions in the interest of time from the Q&A window. But I would like to summarize this panel discussion from some of the key takeaways which I have noted. I know we have very interesting discussion. There were good complementing as well as different schools of thought which came up from the panelists. If I have to think like a healthcare provider, and if I have to think about digitization, I would say first we need to start with a strategy or a big picture in mind. And this would include not the leadership. Of course, leadership is very important to that, but strategy means much more than thinking about our own organization, our own hiring practices. But it also means for us to think the big picture beyond the hospital with our partners, what role they have to play, how can we complement and how can they complement in the digital transformation journey across the value chain. And I think this collaborative approach of building a technology strategy upfront would be an essential first step in the digital transformation. And here I appreciate both the schools of thought by Mr. Avinash and Mr. Jalan. Here, I mean, looking at the stakeholders, it is quite interesting. And that is the second important point, according to me. I found from this discussion that understanding stakeholders is the next important aspect. And it is not the second after building the strategy. And I think this should happen in parallel. Rather, it should happen before even devising a strategy. First, get to understand the stakeholders. And I'm very cautious to use the word stakeholders here and not customers, because personally, I don't like to use the word customers in the healthcare context, because patient is much, I mean, if I have to define a patient, it could be beyond the term customer. And secondly, the different views which we have got from the panelists also emphasize that the internal stakeholders and the external stakeholders have an equal role to play. And that's why I think understanding stakeholders both in and out of the healthcare organizations is the very important aspect. And I would term this as either customer centricity, rather a stakeholder centricity, if I have to correct myself, stakeholder centricity and technology strategy, which should be the first initial steps. I also found some interesting points which talk about the understanding the needs from the stakeholders and trying to build the trust, which is the most important aspect in the overall success of the digital transformation. And talking about transparency, let me be cautious to use the word intentional transparency, the proportion of which should be significantly higher than what we generally think about the other marketing gimmicks in the bigger picture. The intentional or intentional transparency or trust building activity should also go hand in hand in the digital transformation journey. And this is my second key takeaway. And coming from the process improvement background, I found something very interesting, which some of the panelists have mentioned, that, hey, digital transformation is not just about going and automating your processes. It's much beyond that. And there are two important aspects which our panelists emphasize. One is the people aspects, how clinicians respond. And of course, it is a variable to see whether the tenured clinicians have more resistance for this vis-a-vis the young generation people, the clinicians or nurses. But as a whole, change management, which plays an important aspect from the people perspective, which also have a bigger role to play in digital transformation. And the process aspect, which I found interesting, was about the garbage in, garbage out philosophy, right? I mean, automating a bad process is still going to be a bad process. I mean, first, it is important to conduct a process improvement. It could be standardization, it could be integration, or it could be a combination of both into the system at different levels or different degrees. But improvement should be the aim, and digital is the enabler for that aim. And these are some of the key takeaways which I have noted from the discussion. And this also helps me with two important questions in my mind. One is always do this audit of two questions in all the healthcare providers' mind. The first one being how your clinicians adopt the overall digital technology, the inside view, and how your customers feel, or rather the patients feel, about the digital technology. One is the clinician's view or the internal view, and one is your patient's view, how they feel about the technology. Both of them matter. And with this note, I should thank all the panelists for taking their time and also to answer some of the questions in the Q&A window. And I will hand over the proceedings to Ritesh. Thank you, everyone.
Thanks, Professor Vijay. That was a very, very neat summary, I would say, and I hope everybody has benefited from it. And I would really like to pass it again over to Soumya, who we have here. And Soumya has been phenomenal in anchoring this entire initiative from where we were today. When I remember we started the first conversation where you were there, Mr. Jalan, Professor Sarang, obviously, got this brainchild, and then Soumya was trying to all together to where we are in terms of syndicating some of those research and developing it. It has gone a long way. So yeah, over to you, Soumya.
Thank you, Ritesh. I just wanted to take a minute to sort of thank all the participants, panelists, and of course, Professor Vijay and Professor Saran, on behalf of the Max Institute of Healthcare Management, which is part of the Indian School of Business. So this is the start of a continuing discussion we're going to be having on digital transformation of healthcare organizations. I know there are a lot of discussions that happen from a very tech perspective, but I think what we have identified is that this conversation also needs to move to the provider perspective, and then sort of bring a bridge between the two conversations, that is when there is going to be a confluence, and we are going to see the benefit, it benefiting the industry. So please stay tuned, keep in touch with us on our LinkedIn page.